Hi everyone, this is Dr. Pavithra here. Today the topic of discussion is real-time PCR. It's a question that's come up over and over again where people see this term in the newspaper, in the news, in their own blood reports without really understanding what it means. There are many terms thrown around. CT value, what does the real-time PCR mean? And things like that. So in this video, I'm going to explain to you what a real-time PCR is. In a very simple word, one-line answer, it means it is a test that is used to determine whether you currently have a COVID infection or not. A longer explanation is what follows in this video, and that will help you understand the report a little bit better. Every cell or a virus has either DNA or RNA. This is the coding language of life. There are specific portions of the DNA or RNA code for specific functions. In the IT business, people use different programs and give different commands for the system to perform different functions. This is the equivalent in biology. Over time, evolution has chosen DNA or RNA as the coding molecule because it is resistant to heat and it doesn't degrade very easily. This is the first point that you have to remember very clearly. The second point is this template, the DNA and RNA, has a mechanism in which it can be copied every time a cell grows without making any mistakes. This is also very important to remember when it comes to understanding what RT PCR is. The next step is to understand what PCR is. PCR is a Nobel Prize winning technique invented by Kary Mullis, where specific portions of DNA or RNA can be amplified outside the cell using an enzyme and heat. So this process actually won the Nobel Prize for Kary Mullis. Now PCR stands for polymerase chain reaction and RT PCR stands for real-time polymerase chain reaction. PCR simply determines the presence of a specific portion of DNA or RNA, whereas real-time PCR determines how much of that specific portion of DNA or RNA is there. In every round of amplification, the amount of DNA doubles. Now, for example, if the sample has gone through 30 rounds of amplification, it has doubled by 30 times. So that's 2 power 30. That's what it means. The most common term associated with RT PCR is what is called CT value. CT value stands for threshold cycle. In order to understand this, you need to understand what limit of detection is. Every test can determine a small amount. Below that, even if the sample is present, it cannot determine that. Compare this as an example. For example, with your eyes, you can see. However, you can't see bacteria or viruses because our eyes simply cannot see things that are that small. That is the same case for this real-time PCR as well. So when you start amplifying the DNA or RNA multiple times, at a certain cycle, say in 10, 12 or 14 or 16 cycles, you start to see the specific portion of DNA or RNA you are looking for. That cycle is called the threshold value or the threshold cycle. What it means is, if there is more DNA or RNA to begin with, of your specific region. In this case, if it is COVID, if you're looking for COVID DNA or RNA and there is more of it in the sample, the test will be able to see it much faster, which means the threshold cycle, the CT value will be low. Whereas if there is less amount of COVID specific DNA or RNA in the sample, the amplification has to take place a lot longer before it can be seen by the test, right? So when at this point the CT value will be high, which means the person has a lot less viral DNA or RNA in that sample to begin with. If you have taken an RT PCR test, you will know that sometimes the report has that threshold cycle value, the CT value, sometimes they don't. This is because it's not always very important for the treatment plan. Especially for coronavirus, a low CT value does not mean a person is super sick. Or a high CT value does not mean a person will only have a mild infection. Your doctor will make that determination based on your age, the CT value and other comorbidities and other symptoms that you have. So sometimes all a doctor needs to know is whether you're COVID positive or not. Sometimes the doctor needs to know whether you will fall very sick or not and base your treatment plan according to that. So don't just take this CT value and assume as you will get a specific treatment plan. Your doctor will determine that based on all these factors put together. I hope this explains to you what the RT PCR is and how to interpret your reports. Thank you.